Hello, my name is Sharon Garrett. I'm a registered nurse. Today I'm going to do a presentation on tinea. Tinea is a skin infection commonly known as ringworm. It is a tiny fungal pathogen called a dermatophyte that infects the skin. This is a skin infection that can transfer from human to human, and it also can transfer from pets to humans. It can be found in cats and dogs and other animals, and it also can transfer from inanimate objects to humans as well. So things like bed linens and combs and gym equipment. Some signs and symptoms. Clinical symptoms are itching, pruritus, redness, scaling, pain, and burning of the skin. Microscopic skin scrapings under culture show the fungal pathogens are present, and that's how it is diagnosed. Commonly, it is found on arms and legs, but more common areas that it can be found on the body is the groin, the abdomen, or the abdominal folds, and the feet. But it can occur anywhere on the skin. It is given its name of ringworm because of the appearance of the rash, which is red raised rings, and this typical appearance is what gave it the name of ringworm. Categorized into four main types, it is categorized according to where it's located at on the body. Tinea pedis is on the feet, athlete's foot. Tinea corporis is found on the body. Tinea cruris is located in the groin, commonly referred to as jockage, and Tinea capitis is located on the scalp. Treatments or nursing concerns, things that we would want to focus on would be to educate the patient or the client on how to avoid spreading it to others in the household. It is a fungal infection that can be spread through contact directly or indirectly, as I mentioned earlier. The dermatophytes live in a humid, moist condition, and so that's why gyms and other close living areas or environments or athletic centers are common places where this can be spread. Good hygiene and not sharing products and clothing is the best way to prevent it from spreading. Before we discuss topical treatments, a quick review of the skin structure will be done. We have three layers of the skin: the epidermis, the dermis, and the subcutaneous layer. The epidermis has three layers, sublayers in it, and this is the layer that has shedding of the skin cells. These shed every 30 days, approximately. This layer has three types of cells present in it: cells for UV protection, for immune defense against the environment, and the touch receptors. The dermal layer is approximately 1 to 4 millimeters thick. It also has three sublayers in it. This is where hair follicles, glands, blood and lymph vessels, and nerves, along with many other cell types, are found. The subcutaneous layer, or the adipose tissue, this is where fat cells are, and also has collagen present, and the larger vessels, blood vessels, are found there. So typically the topical treatments are going to be very effective against tinea, especially all the tineas except for Tinea capitis, the one found on the scalp. This one is usually more difficult to treat and will require an oral antifungal. The topical treatments are generally going to be used for 2 to 4 weeks and are applied twice a day. Some common drugs that are used are clotrimazole, miconazole, and ketoconazole, and many of these are sold over the counter. They can be found in lotions, foams, shampoos, powders, and different various solutions for application. These work by inhibiting cell membrane construction of the fungal pathogen, and this leads to the fungal pathogen death, cell death. Side effects of the topical treatments include rash, itching, burning, swelling, and pain. A study that I had read by Starry and Sanow was a study that they completed with fluconazole, which is actually an oral antifungal, and they did this for the treatment of tinea corporis and tinea cruris, and they had approximately 100 participants in the study, and the fluconazole was given one time weekly for approximately 2 to 4 weeks, and they found that it lives 2 to 3 times longer in the stratum corneum, which is the very outermost layer of the epidermis, and mostly where the dead cells, the cells that don't have nuclei, are present. And they could find fluconazole in there for had a long length in the skin cell structure there, and it was able to prohibit the growth of the dermatophytes, and therefore it was extremely effective. They had approximately 90% of the participants had complete reduction or elimination of the tinea. They did have a few that had to be discontinued off the study of the fluconazole because of GI distress, which is the main side effect of that particular medication. This concludes my presentation on tinea. Thank you.